What makes the Anway so unique is that we are specialized in OCD and trauma, not one or the other, and we are all rooted in evidence-based care. So we use the gold standard ERP, ACT, EMDR, and I-CBT, all things that have wonderful research to back them up, and we're really accessible. That's a high priority for us to make sure that we're accepting most major insurances and that we have a range of self-pays to really be able to meet every client where they're at. Most specialty practices run in really high self-pay rates, and so we're able to do both. That's what's really unique about us. I started the Anway because I wanted to offer something where there was high quality care and yet insurance is accepted and we could still find rates that were workable for more families. So we wanted something that could actually meet most people where they're at and still make sure that it's evidence-based and accessible. The Anway therapy was named after the Anway model that I came up with, and it's the model in which I live my life by. And I found a lot of internal peace by being able to use so much psychological flexibility, being a lot more fluid in the way that I think about things, that I don't have to be all or nothing, that not everything is black and white, that there's not just an either or decision all throughout the day, that there are all these in-betweens that we can access. And another big part of the Anway is being able to face discomfort and know that there's growth on the other side. So that's what we practice both in conflict resolution. It's what we practice in being able to work through inner conflict and be able to face all the difficult experiences that OCD and trauma can present us with. One of the questions we get most often is whether or not virtual is right for you. I have found that virtual is an amazing option for most clients. I've actually been doing e-therapy or online therapy since 2011. So I've always been passionate about how it creates accessibility for folks that maybe don't have transportation, or it causes a big disruption to their workday to have to get to session. It also allows a lot of people to feel more cozy and comfortable in their home. And when we're doing, especially ERP for OCD, when you're doing exposures in your own setting, a lot of times you're actually able to access some of those tough situations or potential contamination settings that could be really highly effective in that environment compared to if you were doing it in someone's office that's not personal to you. It's also really beneficial when doing trauma work to have a supportive environment and some supportive other items and people around you. And our website has an explanation of those different modalities, EMDR and ERP. Go through our website and through our therapy blogs to find out more about whether those would be a good fit for you.